Good afternoon, everybody. I'm Chuck Wight, president of Salisbury University. As most of you know, Salisbury University started a move-in process last Saturday, and it goes through this Sunday. It was expanded to more than a week so we could practice social distancing and de-densify the residence halls as our new and returning students come to campus. As I spoke with students and families during this process, I was reminded of why we do what we do and why it's so important. Of course, I saw anticipation, especially from our freshmen ready to embark on this learning journey, but I also saw excitement for the opportunity that is made possible by us staying true to our mission. Salisbury University's faculty and staff are a team dedicated to providing the best possible education and support our students who have decided to call this place home. I am so proud of the work that's gone into making SU a great place to live, learn, and lead, even during these challenging times. It's going to take all of us working together to maintain this great environment. We all must do our part to protect the flock. I'm happy to announce that our dashboard to track SU testing and cases is now live on the coronavirus website. Results and other indicators can be viewed in real time. Right now, even after another set of results are in, our positivity rates remain below 1%. This is excellent news, but we must remain vigilant and keep up the great work and attention to health and safety advice that's gotten us this far. Case numbers and other indicators can change very quickly, forcing operational changes, as some of our sister institutions have already discovered. Wearing masks and avoiding large gatherings are some of the most important guidelines to follow. These are part of our codes of conduct, and disciplinary action will be taken for those who don't abide. The progress of an infectious outbreak follows a geometric progression, so the actions of every individual have the potential to impact our entire population. So it's up to all of us to remember that every single day. Continued and ongoing testing is also important. We've posted testing dates for next week and for the rest of September. Tomorrow is the deadline for faculty, staff, and students to have scheduled and submitted their initial test results to SU before returning to campus. So if you haven't already been tested, please sign up right now. Also, if you're randomly selected for a repeat test, or if you just want to get another test for any reason, just sign up. Free weekly testing will continue to be provided for the campus community every Tuesday and Thursday morning in September. We strongly encourage you to continue taking advantage of this free opportunity. And don't forget to complete your daily symptom screening. Whether you live or work on campus or off campus, we're asking you to use the SU mobile app to track and report your symptoms every day. Of course, this is mandatory before coming to campus on any day. Finally, I want to say thank you to our friends and neighbors in Salisbury and Wicomico County. Thank you for the support that you've shown and the way that you have welcomed us back with open arms. It means the world to me, to our students, our employees, and the entire campus community to have such care and compassion from this wonderful community. Thank you all, and I look forward to taking your questions right now.
Dr. Wight, could you talk about the measures being taken to prevent parties on and off campus and in the ways that the university is collaborating with local partners and local law enforcement?
Sure. So parties and large gatherings are one of the things that most threatens our continued stay on campus. And so parties and large gatherings are prohibited by our student code and by the code of conduct that our employees also have to follow. So we have a number of different ways of making sure that these guidelines are followed. First of all, there are new resources on our coronavirus website for people to report whenever they encounter a party or a gathering that doesn't look like it should be. Feel free to just use those resources and we will respond immediately. Sometimes, in extreme cases, law enforcement will have to be involved and they are ready to back us up.
Thanks, Dr. Wight. Could you talk about what would happen in the unfortunate case that COVID positivity rates were rising on campus and how that would affect instruction modalities?
Sure. So we have a whole range of about a dozen indicators that we are following in order to help us to make any decision that we might have to make about changes in operational level. Just as a reminder, we're at level 2 right now, which is normal operations but de-densified to help to slow the spread. And so if we got a surge in positive cases like has been experienced at many other universities, then we would take a whole range of factors into account in making a decision to go to online only, or in an extreme case, we might even have to close the campus and continue all instruction online for the remainder of the semester. But that decision will be made in consultation with our community partners and especially with the Wicomico County Health Department.
Dr. Wight, SU required a negative test to be on file to start the semester, but will students or employees need to have another test at any point during the semester?
So we did ask, in accordance with University System of Maryland rules, everybody to have a negative COVID test on file before you can access any campus resource or building. So that's an important mechanism for starting with a very, very low positivity rate on campus. We've always said that it's impossible to maintain a completely free COVID-free campus, but we want to start in a very, very good place, and I think we're on track to do that on Monday.
So just what would happen if there was a rise in positivity rates? How would that impact course instruction?
So if we had a rise in cases and it got to the point where the infection is out of control, then we would have to move to an online instruction mode.
And Dr. Wight, can you talk about some of the options that will be available in the dining halls for those that might want to eat in the halls or those that want to take their food elsewhere?
Sure. So the dining halls have been de-densified in order to keep a social distance at least between all the people who choose to eat in the dining hall. But there are also grab and go options in the dining hall, so you don't have to stay at all. You can just come into the dining hall, get the food that you want, and leave and eat somewhere else.
Could you talk a little bit about the isolation protocols for campus and what might happen if a student were to test positive?
Sure. If a student tests positive, then we would go immediately into action to make sure that the student is isolated and cared for. That's the most important thing for us to do. Now, in many cases, the best care that a student will be able to get while they're ill is to go home to their home, wherever that is. And in many cases, we will encourage students to go back to live with their parents if that's where they came from. In some cases, that would be inappropriate or not possible, and so we are prepared to isolate students in an area of our residence halls which is set aside specifically for this purpose. And then we would care for those people using student health and make sure that they get the food and other supplies that they need and access to their classes and so forth so that they could continue the educational process.
Thank you, Dr. Wight. Those are all of the questions that have come in today.
All right. Well, thank you all for joining me today. Make sure that you practice all of these good practices, wear your masks, social distance, practice good hand hygiene, and help to slow the spread of the virus and protect the flock. Thanks, everybody.